Hello and welcome to the Headache Doctor podcast. I'm Dr. Taves and I'm joined again by Dr. Stoerzbach. Thanks for being on the show, Dr. Stoerzbach.
Of course.
As always, it's our mission to empower and educate everyone with headaches and migraines to break free from this debilitating pain, this life of fear of your next headache or migraine and dependence on medication. And we want people to thrive in whatever they want to do. And so on today's podcast, we are going to talk about a common barrier that we think is in our healthcare system, kind of built into our healthcare system, and something actually that affected me and Dr. Stoerzbach. I'm sure this had an impact on you as well, but and I think something that impacts a lot of patients. What we're going to talk about is how neurologists and the service that neurologists offer needs to be perceived appropriately. And so we're going to talk about what that means. How should we appropriately view neurology and what it offers for the person that has headaches and migraines? And so an inappropriate view of neurology can lead to a couple things. It can lead to a patient maybe getting a recommendation from a neurologist and assuming that they will not find something outside of that's valid or credible because the neurologist is sort of the primary authority within the headache or migraine world. It can also do the opposite, where maybe the neurologist recommendation comes with so much weight that it might paralyze or scare a patient so much so that they have sort of this hypersensitivity or sort of this sense of my pain is worse than it is. And then the last thing is we never want people to get stuck on this road of medications, taking medications and thinking that's the only solution for them. And that's probably the most common thing that we see. And we're going to talk about why looking at neurology appropriately, they can be utilized appropriately and the medications can be utilized appropriately in the right context. So that's what we're going to talk through today. Let's first start off with going through sort of a list of migraine diagnoses, because I do think this starts with the diagnosis process. We've seen, it seems like every type of headache and migraine. One of the things that people comment all the time, whether it's on our social media platforms or here in the clinic, is, how do I know if I have a migraine? Do I have a migraine? Neurologists have told me I don't have a migraine, or I do have migraines. And that seems to be sort of an important thing for people to understand. And so we're going to go through a list of diagnoses that we found through the International Classification of Headache Disorders. And this is a classification list that comes out, and they update it, revise it every now and then. But yeah, let's just kind of pick through this. And Dr. Stoerzbach, I'll have you just kind of briefly go through these different diagnoses and maybe just talk about, have we seen these? Have we not? I mean, is this something that we would say, no, let's not work with this type of patient? I mean, when we look at this diagnosis, what should we be thinking?
Yeah, so there are quite a few diagnoses, which can feel very overwhelming, I think, to people. If you were to go on this page, you'd see almost dozens of different types and subsects of migraines and headaches, and that can feel really overwhelming. And people will sometimes attach themselves to a diagnosis, when sometimes what it's doing is just simply kind of describing their symptoms. So let's kind of go through the list here. The first one is just migraine without aura. Aura means like a visual disturbance or kind of that sensation that a migraine might be coming on. So that's kind of one subsect. And then we have migraine with aura. So that there's even more of a subsect in that, migraine with typical aura, and then even typical aura with headache or without headache. So that gets confusing. Now, again, what's the difference between my migraine and my headache? There's hemiplegic migraine, which can present more like stroke-like symptoms. They have now familial hemiplegic migraine, which just has a genetic component. Sporadic hemiplegic migraine, and retinal migraine. Those are more thought to cause from the eye. So, but then we go down from there, and then there's chronic migraine, and there's even one on here I think is kind of funny. It's called just probable migraine with or without aura. And I honestly think that's probably just, they're just not quite sure. So they just made up yet another subsect of, it probably is a migraine, but it doesn't maybe fit all the perfect criteria. So this is what we'll call it. There's episodic migraines that actually have like the gastrointestinal disturbance. So that's that GI upset, stomach upset. Some people will even have nausea and vomiting. And then there's even a subsect for vertigo. So some people will have that dizziness and vertigo with their headaches. So that kind of takes you through the long list. And to me, it kind of just takes people through their symptoms and puts them into a category. I will say we've seen just about all of these in our clinic, and some will come in with multiple diagnoses. They'll say, I saw one doctor that told me I had chronic migraine, and one other doctor just told me I had a cluster headache, and one told me I have trigeminal neuralgia, and those are other diagnoses that aren't even listed here on the migraine page, but they'll have multiple. And again, I think, of course, we need, as scientists, like lists and data and diagnoses, and I get that, but most headaches are stemming from a similar area, and this is just kind of putting them into describing their symptoms for them.
Yeah, absolutely. So the takeaway here is when you go to see a neurologist, one of the things that you might be hoping for is that sort of specific diagnosis so that you can put a name on it. And we've talked about this before on the podcast, but it's important to understand that everything we listed, all these, so migraine with aura, without aura, even like retinal migraines, and these cyclical vomiting syndrome. So these are all classifications of migraine that are essentially describing what you just told your provider. So if you walk in and say that you have sort of this sensation, whether it's visual or maybe you have numbness, tingling, something like that gives you a sense of, I might be having a migraine, and then you have head pain that's one-sided and kind of this throbbing, debilitating sensation. That sort of description allows the provider to say, okay, we're going to classify this as a migraine. And so there's really not this sense of profound, we've discovered something, or this gives me a good sense of direction on where we're heading. And so that's the first sort of thing we want people to understand appropriately, is that these diagnoses within this classification system that the neurologists are using should be looked at as just a sort of a fancy way of describing your symptoms and putting you into a classification that really leads to certain medications. And so having these diagnoses is not necessarily a step in the right direction, not necessarily being the key there. They can be helpful, but for most people, I would say it's not necessarily getting you closer to your goal. And so when you see a neurologist, kind of hold that loosely, hold that diagnosis loosely, and understand it as just a way of describing your symptoms and classifying you. So that's
and just to add to that, I mean, I think on our end, it's the same with like imaging. I always think, is this going to change treatment? And if you were to ask maybe your neurologist, like, does this diagnosis change what you're going to do with me? They might say yes, because their thought is medications maybe respond differently to different diagnoses. But as a PT perspective, it doesn't change treatment. And I just think that's always very important to like step back and think about that. Don't get so hooked up on those words if it's not going to actually change your outcome or your treatment much. Yeah,
I love that. Because that's what people really care about. They want to get better.
Right.
Yeah.
Right.
All right. So the other thing that's sort of like right there in our face, like it's very apparent. This is not like you don't have to dig very far to see this sort of stuff. But what we're going to talk about is when you try to find the source of migraines, what causes a migraine. If you type that in, either you'll get like I don't think I could even find it on the Mayo Clinic website. I don't think they addressed it. And then on the Cleveland Clinic website, it's if anyone listening to this is involved with the neurology department at the Cleveland Clinic, you might want to change how you worded this here. But what causes a migraine? clevelandclinic.org. So the cause of migraine headaches is complicated and not fully understood. When you have a headache, it's because specific nerves in your blood vessels send pain signals to your brain. This releases inflammatory substances into the nerves and blood vessels of your head. And my favorite line is this last one. And it says, it's unclear why your nerves do that. So there you go. So all of you people that have been just going through life with this debilitating pain, and you're just like, man, like what is causing it? And you think, man, like if I could only just travel to the Cleveland Clinic and they could make my life so much better. Well, they're what they're working off of is it's unclear why your nerves do that. Mm-hmm. And that's sort of sums up our frustration with the healthcare model and how it's treated people with headaches and migraines. And of course, it's not because they don't want to know why, but it's just because they're looking at it the wrong way. And so in that statement, they talked about nerves and blood vessels sending pain signals. As physical therapists, it's not hard for us to see that pain signal as coming from a different area and affecting the brain's perception of what's happening in those blood vessels. That's actually very common. We see this sort of pain pathway complicate other structures within the head. And so it's a very reasonable explanation to say like, hey, we think the neck could be a part of this, especially if you get into the neuroanatomy of the neck and those peripheral nerves, how they lead through the brainstem. So anyways, that is sort of what these neurologists are working off of. And I'll just briefly go into a little bit of my story when I started out, because I was seeing people with headaches, and then if anyone would come in with a migraine diagnosis or migraine-like symptoms, I would always get a little bit like nervous or not sure if I was the appropriate provider for them. Mm-hmm. And what that was is the system that we're a part of makes us feel that these neurologists are the most appropriate provider for someone with a migraine diagnosis. And so that was limiting to me as a provider, even though I had these tools to really help these patients. In my head, I was thinking it was inappropriate if these certain symptoms were showing up, I should refer them out. And so what I did was I took a deep dive into I didn't even need to take a very deep dive. I mean, if you just look at the Cleveland website, it's right there. But trying to understand what are these neurologists working off of as far as the source, and how are they treating the source, and what do they understand as a source? And it really is as simple as they don't know. And if I guess I would say if a neurologist tries to tell you that they do know, they probably have information that is maybe not published yet. It's not out there. And so, or maybe they're working off sort of a theory that they have, but what we're trying to do is provide sort of context into the source of it. And neurology, not to be too critical here, but they're not necessarily, the system they work off of is not based on the source, which is the important part. Mm-hmm. Any thoughts there?
No, I think you said it well. I really think the take home here is, a lot of people think of the neurologist as hierarchy. They must kind of know the most about the most, and they might not be well equipped to actually handle this problem, whereas PTs are. And I just think that's a big takeaway today. Yeah.
All right, let's jump down to the CTs and the MRIs, the imaging, because this is also associated with neurologists. Oftentimes patients will receive a CT or an MRI, and we want to look at that appropriately too. So the key word of today's podcast is understanding appropriately what's happening and how we view this process. So let's, Dr. Stoerzbach, talk a little bit about kind of the difference between CT, MRI, why someone would get those, what that means, and we can kind of go on a little tangent of the X-ray that maybe a chiropractor would take.
Yeah, so CTs are more common in emergency rooms, and so more likely if you've been admitted to an ER for a headache, that's the tool they're going to use. It's actually quicker and probably less expensive. And that's one of the reasons. And with MRIs, there's actually a little bit more detail there. Primarily what they're trying to do is rule out anything that would be a red flag, something completely outside of the musculoskeletal system, such as a brain tumor, a brain bleed, something in that realm that they really need to pick up on and treat differently. Anything else that you can think between?
No, I think that pretty much sums it up. So the CT MRI, again, if we go back to how this process is diagnosed, those diagnoses are not relying on a CT or an MRI. And so the CT or MRI is just ruling out, the really bad things. Those things are very, very rare, though. So most everyone with headaches is not ever going to really need a CT or an MRI. They just kind of do that because, especially in the emergency room, because they want to make sure they don't miss something. But then oftentimes, either primary or more likely neurology may order those. And usually that's, if you have a dramatic change in your symptoms, if you're at a certain age, if there's more of a recent onset, things like that can indicate more CT MRI. And then it's just the provider's preference. I mean, I'm sure there's neurologists out there that kind of, do MRIs on most people with migraines. And that's just maybe not the most evidence-based approach, but just that's what they prefer to do. And so depending on who you see, that can be a different experience. As far as like x-rays, we personally don't typically recommend x-rays just because we're focusing on movement. And so the reason someone might get an x-ray, and likely that's from like a chiropractor, sometimes it can be from a primary care doctor or something like that, but they're looking at alignment as far as the chiropractor is concerned, and especially if it's after like a motor vehicle accident or a whiplash injury, some sort of head or neck trauma, it actually would be appropriate to get an x-ray to rule out any sort of fracture. So that would make sense. We just very rarely see someone like a day or two after they've had an injury.
Right.
We're more in the I've had migraines for 10 years and these won't go away category. And so usually all this stuff is sort of like, they've checked all these boxes kind of in the reverse order where we want them to see us first, but unfortunately that's not the case. All right, so how should we appropriately think of neurologists and where their specialty is? Because they do have value for the patient with headaches and migraines, and I think a lot of people listening would be like, well, my neurologist is great. They've listened to me. They've prescribed medication that's been very helpful. They've led me down a good path. And so, and that's awesome. And we love the good neurologists out there. Sometimes that's, and actually probably more commonly is we hear the bad stuff. My neurologist didn't listen to me. My neurologist just dismissed my symptoms. They were short with me. They didn't spend any time. I don't feel like they know really what I'm suffering through. And so what I would say, what we would say is that a neurologist has a very, they have a greater breadth of understanding and knowledge when it comes to medications and what medications are appropriate for a person that's struggling with headaches or migraines. But they don't necessarily have a better understanding of migraines themselves. So what that means is if we're thinking about the skill set that neurology has, and why we would go visit a neurologist, it's because they have like the next level of expertise on managing those medications. But I would encourage people not to think of them as having a better understanding of migraines when it comes to the source and how to treat the source. And so that's an important distinction, because when you see the neurologist and you walk away with a recommendation, likely it's going to be something that has to do with medication. And so that's appropriate. That's what you should expect, but you should not think of that as they understand your migraines, and because you saw the neurologist, that is sort of the final step, because it's likely not the final step. Any feedback there? Yeah,
no, I completely agree. They are definitely the expert on the medications, and so if for the short term, it's amazing to help manage pain. And then there's also the period when people want to come off their meds. There's a lot of people during treatment with us, they want to come off their medications but most of them have to be monitored and weaned appropriately. And so that's also the neurologist can help quite a bit. We also have several patients that receive Botox injections from their neurologist, and when they work really well. And so that's another thing, another specialty the neurologist can provide.
Yeah, absolutely, because this pain is so debilitating that medications are not bad, especially short term. A lot of people find a lot of relief through their medications, and so we're very thankful for that. And so what we would encourage people to think when you go to these providers, like if you were to come to us, and there's a lot of different like contexts that we could say this in as physical therapists, where we think other providers are sort of overstepping their expertise. But if you would come to us and we would start making recommendations on medication and how to manage those, that would be out of our scope of practice, and that would be inappropriate. And so our sort of push against the current model and how it's set up is, if you go see a neurologist, it would be inappropriate for them to evaluate your neck and rule out your neck as the source of pain. And so if a neurologist is clearing your neck, that is what I would say is sort of overstepping their understanding of the neck. And that really needs to be a physical therapist that understands this problem and can do that appropriately. So that's just sort of understanding their expertise, utilizing them appropriately, and we're not in the business of sort of like bashing other professions or talking down on other professions, but it is important to understand the sort of the expertise and specialty and looking at it appropriately, because ultimately it all drives back to, we want you to get better. We want you, the listener, to find relief, to find the treatment for the source of pain rather than just relying on medication. Any other final thoughts here, Dr. Stoerzbach?
Just that, the patient should always be their own advocate, and sometimes the best results come from the patient that pushes and does their own research and sometimes pushes back against their doctor. So don't be afraid to do that.
Yeah, absolutely. So thanks for listening to the Headache Doctor podcast. Tune in next week. Every Monday, we publish another one of these, and our podcast platform is growing, our reach is growing, and we're just so thrilled. If you've been impacted by this, I want you to share this with someone, especially if you know they have headaches or migraines. It's so common. This is such a common issue that we want to get the word out. And then if you have been debating on reaching out or working with us, please do that. We'd love to help you, whether that's virtually or in person. And we appreciate everyone who supported us, because we know we're sort of onto something when not only our patients are getting better, but just this sort of like impact we feel like we have on people. It's a lot of fun what we do.
We're very lucky.
So thanks for listening. As always, it's our mission to empower and educate everyone with headaches and migraines to break free from that life of fear and dependence and thrive in everything you do. Stay tuned next time.